Hi everyone, this is Fostalicious Do It Yourself. Today I'm going to be discussing a very pressing topic for which most parents bring their newborn babies to the hospital, especially at night. They bring these babies to the hospital before they are 3 to 4 months of age, complaining that this baby is crying excessively, this baby is crying uncontrollably, and that they have done everything in their power to keep this baby comfortable and calm, but all their efforts seems not to work. With this, let me introduce today's topic, which is infantile colic. Infantile colic is characterized by a sudden outburst of unexplained and uncontrollable crying in an otherwise healthy and well-nourished baby. It seems to occur mostly in babies from ages 2 weeks to 4 months of age, and this affects about 10 to 30% of all babies worldwide. When a baby is experiencing infantile colic, they cry excessively and they seem inconsolable. It is usually a dramatic period, and it seems to occur around evening to night time most days. It is important to examine this baby physically to ensure that the fussiness and irritability in this baby is not from any physical injury that might be causing pain for the child. Ensure that the child is not hungry and that the diapers are not wet. Also ensure that the baby is putting on a comfortable clothes, because some clothing materials and the labels on them can cause itchiness and irritate the baby's skin, which can make the baby to also cry. After you have ensured that the baby is normal, apart from the loud, episodic, uncontrollable crying, be rest assured and also assure the parents that this baby's colic would resolve spontaneously when he or she is about 3 to 4 months of age. Truly, this is a difficult period for both the parents, the caregivers, and the baby herself. You can take the baby to the hospital, but lab tests are not routinely needed. However, the doctor can educate the parents and the caregivers on how to properly feed the baby in an upright position. Breastfeeding is the best at this time, but if your baby is being bottle fed, it is essential for you to use anti-colic bottles. That is, those bottles that have vents, tubing through which air escape from the bottle, or cuffed bottles. These kind of bottles reduce the amount of swallowed air by the baby as he or she sucks. Bopping babies with infantile colic regularly is a must, because this helps to release excessive gas from their stomach, and this gives them a relief. Do not keep such babies hungry. Do not overfeed or underfeed such babies. Soothing maneuvers like gently rocking the baby is also essential. Dancing and singing nice music for the baby can also help. Taking the baby outside for a ride or for a walk in their stroller would also help to soothe their pain. You can gently rub their belly. It's also good to give them a warm birth. Do not shake babies with infantile colic. Parents and caregivers should take turns in holding and soothing the baby because one person would most likely get tired at a time. Keep the baby calm in a dark or dim room. This would help them to sleep faster. Mothers of babies with infantile colic who are on exclusive breastfeeding may consider reducing or eliminating the consumption of some foods like egg, milk, nuts, caffeine, and other foods that can trigger allergic reaction in the baby like vomiting, diarrhea, wheezing, eczema, especially if the mother herself is atopic. Anticolic drops like simeticone drops, grip water, and so on, they are widely used, but their benefits are unproven. So these are not actually recommended. Just hold the baby comfortably, rock him or her gently, dance and sing nice songs for the baby. Avoid overstimulating these babies and do not shake these babies at all. Parents and caregivers should control their emotions and frustration at this time. You should not be angry with the baby. It is normal for healthy babies to cry. It is not abnormal for any baby to cry at all. Take charge of the situation, be in control of the situation, and be rest assured that your baby would soon outgrow this infantile colic phase by the time he or she gets to 3 to 4 months of age. Thank you. Feel free to share this video to your friends, to your family. Note that my intention of making this video is to give you the basic health education you need to be aware of. Therefore, the teachings herein does not take the place of recommendations from a licensed healthcare professional. So please always consult your doctor for proper management of your healthcare issues. Thank you and God bless.